Myth or fact, testosterone pellets are the only form of testosterone replacement for both men and women. I'm Dr. Davis with Woodlands Wellness and Cosmetic Center, an expert in hormone therapy, and I'm here to tell you there are many different options that you can use for testosterone replacement. So, let's talk about testosterone. There's been so much controversy over the last few years, and there are so many physicians and practitioners now trained to use pellets, which are not for everyone. I do feel that pellet therapy is definitely a great option for some people. I think when we use testosterone pellets, we have this huge surge of testosterone, which is great for some people. They feel like they need that, their body metabolizes it, they have the energy that they want, their metabolism improves, their sex drive improves, all of those things get better. The issue is that over time, your body starts to become a little bit more used to the pellets. And so you may not experience the high that we get with the very first pellet treatment. And we do see that the levels are quite high. So for some women, they can get up to between 250 to 500 milligrams. And those levels sustained may not be necessarily the best for every single patient. So we have always used multiple different types of testosterone replacement, including creams that you're able to use topically, or lozenges or troches that you're able to use that just melt right under the tongue. With those daily doses, for a lot of women, we find that that is just a better solution and option for them because they find that they feel better with more of a slow release over each day versus a huge surge and roller coaster that can happen with pellets. Now, for men, we tend to favor injections. Once a week or twice a week injections that can be given in the muscle or under the skin give us usually the best results. The pellets can be a very convenient therapy for men, though, especially if traveling and not wanting to take syringes and needles, which of course is very understandable. And for men, again, they do seem to experience a little bit of that roller coaster, but it doesn't seem to be quite as much of an issue as it is for women. So just keep in mind that there's lots of options for testosterone and it can be used very safely for both men and women.